Good afternoon, everybody. We're gathered today on the territory of the signatories to Treaty 7, and we'd also like to acknowledge the Métis people of Alberta who share a very, very deep connection with this land. I'm also pleased to be joined today by two nurses who work here at Rockyview General Hospital. Bernadette Brokel, president of the union local here, and an operating room nurse, and Keith Palmeria, the vice president of the local and a mental health nurse. We are here today to highlight the escalating crisis inside Calgary's hospitals, and especially here at the Rockyview. The Rockyview General Hospital has been forced to divert emergency surgeries to other hospitals multiple times in recent weeks. Not just for a few hours, but for days at a time. This is a major urban hospital that has been pushed to the limit and then beyond, to the point where it simply cannot deliver the basic functions of a hospital. And this is unacceptable. These surgical diversions are a symptom of an entire health system that is becoming increasingly sick. Now, we know that the pandemic has put incredible pressure on healthcare workers, driving them out of the profession, creating the kinds of shortages that cause the service interruptions that we are now seeing. And we also know that this pressure exists across the country. But the situation that we are in today has been made far worse by the hostility of the UCP towards those frontline healthcare workers, and particular to nurses. That hostility actually began before the pandemic. Now, most of us thought the UCP would come to their senses and abandon their war on healthcare workers when a deadly global pandemic arrived in Alberta. But they didn't. They dug in for at least a year. They continued their attacks on nurses, on doctors, on paramedics, on lab technologists, support staff, everyone who makes a hospital and its operating rooms and its emergency rooms work. And it doesn't end there. The soaring demand for care is fueled by UCP cuts to primary care, to our social safety net, and the drug poisoning crisis. We've all heard terrible stories of unacceptable delays to ambulances arriving at emergencies, another symptom of a serious problem. None of this is normal. Now, I know that the health minister is spending 2 weeks in Europe studying their healthcare system, but I would argue he could spend a lot better time spending 2 weeks here at the Rockyview Hospital, listening to these exhausted frontline workers. So I'm very proud that we are joined today by nurses who can provide insight on what is happening in healthcare. And with that, I'll now invite Bernadette to speak.
Hello, my name is Bernadette, and I'm the president of the local 1-to-1 chapter at the Rockyview General Hospital. Every day, my colleagues watch patients in their care struggle to access the surgical services they need because of the mismanagement of the UCP government on our healthcare system. It is disheartening to see our patients being diverted to other healthcare facilities who are already overwhelmed and understaffed. Because I work in the operating room, I cannot help but feel disappointed and frustration that my patients feel every time they are delayed, every time they are postponed or even canceled. I also cannot help but bear the depression and discouragement that my coworkers and colleagues across the province endure under the leadership of the UCP. The conditions in which we work in have gone to a point that so many nurses are leaving the bedside at a rapid rate. It is so easy to look at this problem and assume that the issue with staffing is about numbers, or that nurses are being selfish. The biggest problem that is going on is that the conditions that nurses work in are flawed. We have been sounding the alarm for years, desperately crying out for help. Our nurses are shattered, weary, and not okay. Many are leaving in their first year. They're also leaving and retiring at early ages. We are human beings before we were nurses, so it makes sense to not want to work in the terrible conditions that treat nurses as less than human. Everyone wants to talk about how we can get more nurses into the profession and fill the holes. But we do not talk about why those holes are there in the first place. We have attempted to churn out more nurses, but this attempt has not been working. because we are introducing new graduates to an environment that is unhealthy, toxic, and unsafe. Studies have shown that when nurses take on higher patients, it leads to more poor patient outcomes and patient harm. You cannot expect a nurse, especially a new graduate nurse, to take on a 6, 12, 18 patient assignments and take care of the patients. It is impossible. More people in the workforce would help a bit, but at the same time, new graduates and newly hired nurses are being exposed to the same culture, to the same burnout staff they're trying to stick around because they need the job. And therefore, they leave within their first year. Retention of new nurses in the profession is a high priority. We must supply relief, incentives, and compensation to the thousands of nurses who are on the brink of leaving the profession. This could come in the form of desirable wages to match inflation, more healthcare support workers, and encouraging professional development. We want our requests for personal time, such as vacation, special leave, and education, to be respected. I urge the public to be an extension of our voice and tell the UCP MLAs and MPs that what they are doing is not enough. Vote next year in a way that will protect the public healthcare system and ensure the future of your loved ones will be safe.
Hi everyone, my name is Kate Palmeria and I'm a Vice President for Local 121 at the Rockyview General Hospital. I work as a registered nurse in mental health and addictions, and I've worked in a variety of roles at Rockyview, South Health Campus, and Sheldon Schumer Health Center. I've witnessed how the current strain on the system is being felt in all hospitals across the city. Our health system is in a crisis. Nurses are tired of asking, begging, pleading for the government to listen to us. Patient safety is at risk. Healthcare is a social service, and over the past 3 years, social services in Alberta are constantly being cut, despite being assured that the UCP would maintain or increase health spending. What happens when you have gaps in social services during a pandemic while the cost of living continues to increase is that the people that are the most marginalized will experience significant barriers to their health. When nurses try to provide the best care possible but the resources are not in place, we feel an immense amount of ethical and moral distress. We feel like we're working against a system and a government that will not allow for our patients to receive the care that they need and deserve. In hospital, we assess, we treat, we stabilize, but we cannot discharge someone if there are not supports in place to ensure that they are safe. When a person cannot access affordable housing with proper mental health support, that means that these patients are forced to stay in hospital. When people who require AISH or other forms of income support no longer see proportionate increases with the rate of the cost of living, that means that less Albertans are able to meet their basic needs such as food and shelter. More strain on the healthcare system. When a person cannot access harm reduction services, that means that there will be an increased demand for emergency care, ambulances, and a steady rate of preventable overdose deaths. Again, more strain on the healthcare system. Proper social support is proactive, pragmatic, and preventative. This is how you provide good healthcare that saves the system money, but more importantly, saves lives. I would like to reiterate what Bernadette has said. The UCP is not doing enough. They are not listening to us, and they're pushing a privatization agenda that will harm our already strained healthcare system. I ask the public to talk to the nurses you know, the nurses that are caring for you. Ask them how they're doing. You'll see that they're tired. We need help. And you can help us by talking to your government and demanding better working conditions, less barriers for patients, and following through on their promise to actually maintain and increase healthcare spending, not cutting it. I will end my time today by citing a speech by co-founder Alex from the Liam Project. We are resilient, but at what cost? Compassion is the guiding hand that leads us, and our pain is what feeds us the will to keep fighting for what is just. Thank you.
Thank you very much, both of you, for the work that you do, as well as being here today, Bernadette and Keith. The bottom line is this. The UCP have cut hundreds of millions of dollars from healthcare. That was reaffirmed today with the publication of the annual report. And they have broken trust with the Albertans who work at the front lines. There are currently 23 fully and partially closed hospitals across the province. The UCP attempted to cut the wages of nurses during the pandemic. They tore up the master agreement with doctors, which has driven doctors out of the province, creating massive gaps in primary care. And even today, they're still working on trying to cut the wages of healthcare professionals like paramedics and respiratory therapists. Bottom line is, the UCP is sabotaging public health care, and they've done so for the past 3 years as a prelude to their plans to privatize. Alberta's NDP is committed to protecting and strengthening the public system Alberta families rely on. We will restart the relationship with healthcare professionals and dedicate real resources to the front line that matters so much to all Albertans who want to know that their families will have safe and effective treatment should they need it. Thank you, and I'm happy to take any questions folks may have.
Okay, we'll start with questions in person.
Child waited 20 minutes for an ambulance. It never came. She went into a fire truck for transport. Just talk about the overall concerns that you have as it relates to ambulance wait times.
Well, there are so many issues that are creating this crisis, and we've been calling on the government to act on them, and they have refused. What we learned today is that they actually left money on the table when it came to funding ambulance services last year, which is jaw-dropping to me when you consider the crisis that Albertans across this province are experiencing. We know that there's efforts at staffing and their unwillingness to create long-term contracts for paramedical staff means that they don't have enough staff. And we know that their reorganization of the system is still creating pressures as well. So there are a number of things that they can do to fix the problem, but they're not choosing to do them. And as a result, we're seeing the kinds of stories that are heartbreaking. I cannot imagine being the parents of that child waiting for an ambulance to show up. And yes, you're grateful when the fire truck finally gets there, but is that the way the system's supposed to work? I think not.
The work that the doctors and nurses are trying to do within the healthcare system and hospitals.
Well, it also frustrates us too when our patients can get to us. We're very eager to help. We are there to support them throughout this process. So when we hear that ambulances can get there on time, it also causes an emotional distress on us that they can they can't reach to us. So for us as nurses, our duties have always been towards the patient, to care for them, to take care of them whenever they're in need. We are here to support them, and so when we hear those stories, it really saddens us.
Any questions in person? Stephanie?
You bet. Well, so the fact that Alberta's Treasury is enjoying a significant windfall is, of course, entirely due to the price of oil and has very little to do with UCP management tactics. What is true, though, is that even while that's happening, is that Alberta families are not experiencing a windfall of any type. What we know is that we have 40-year highs in inflation, and that has been made worse by a government that has downloaded multiple different fees and costs onto families in the meantime. And we heard a report today about how low-income families are experiencing a 10% inflation rate just this year alone. So it is incumbent upon this government to actually govern and use these funds wisely. What we saw today is that, for instance, they underspent in our K-12 system by almost $500 million. I have been talking to Albertans on their doorsteps in their houses for months and months and months, and not a single person has come to me and said, my classroom doesn't have enough kids in it. There are too many people taking care and supporting special needs kids, and our teachers really love the curriculum. Those are things that have never been said by a single Albertan who's spoken to me. Yet in the midst of that, this government thought cutting $500 million out of education was wise, or 450 or whatever it was. So the other thing, of course, we know is they left funding for EMS on the table. when we hear the kinds of things we've just heard, it just shows a profound level of mismanagement.
When I spoke to the UCP government about it today, they said that they were passing down affordability measures, $2 billion for things like a provincial gas tax holiday, rebates on utility bill. Mm-hmm. What would an NDP priority, if you were in that position, what would you prioritize with that kind of budget surplus?
Well, to be clear, we initially called for the gas tax rebate. So, I'll give credit where it's due. It's good, and it's good that they're going to extend that. But it's not enough. The electricity rebate, people still haven't gotten it. And moreover, it is paltry compared to the way in which prices have skyrocketed with respect to electricity rebates. And they haven't done a single thing yet with natural gas rebates. Meanwhile, they've jacked up insurance, tuition, utilities. There was a cap on utilities, so people wouldn't even need these rebates if the cap was still there. And meanwhile, personal taxes are going up, and that's impacting low and middle income families the most. So there's a range of things that they can do, specifically focused on low and middle income families who are bearing the greatest burden of this inflationary crisis that all Albertans are experiencing.
Okay, we'll go to questions on the line. First question goes to Audrey Nouveau. Maybe try again, Audrey. I think your line is open.
I don't know if you can hear me right now.
I can hear you now, yep.
Okay, thank you very much. New computer. I couldn't hear the questions of all the reporters, so I'm sorry if I'm asking something you've already touched on, but Rachel, if you were premier today, experiencing this historic windfall, what would you spend the money on, or where would you invest it?
Well, first of all, what I would do is we would make sure that Albertans who need their hospitals to be capable of handling emergency surgeries and who want their kids to get a good education would get them. We would also focus on the affordability crisis that is impacting so many families, especially low and middle income families. But we would also ensure that a good portion of this is saved because we know that in the long term, this is a windfall. It's not something that we can depend on for years and years going forward. And I will say that the NDP caucus will be, we're engaging with a number of experts right now, and we will be rolling out a plan that outlines the principles that would govern how we manage this surplus in the days and weeks to come. But in the meantime, it is not enough for this government to pat itself on the back and throw itself a party while we see families struggling in a way they have not for 40 years with incredibly oppressive inflationary pressures and massive pressures in our healthcare system and funding cuts in our education system.
Did you have a follow-up, Roger?
Yes, and short term, to combat the inflation, what measures would you put in place on top of the gas rebate and the electricity rebate, that we're supposed to have right now?
Well, obviously, one of the other pieces that the government has not addressed at all yet is the natural gas rebate. And in addition, the electricity rebate, we'd need to look at what has happened as a result of them lifting the cap and if there's still more room there to support families back to the position they would have been had the UCP not lifted the cap on electricity rebates. But in addition, we need to look to what low and middle income families are experiencing. The personal income tax grab that Jason Kenney initiated when he first got elected, where he doesn't index income brackets, that is costing regular families hundreds and hundreds of dollars a year, and with the inflation rate being what it is, that goes up, and of course it impacts low-income families the most. The other thing that we would correct is income support, child benefit, seniors benefits. None of these are inflation protected. The UCP voted in favor of inflation protecting them, committed to Albertans that they wouldn't change it, then immediately broke their promise. And now Alberta families are paying an incredibly expensive price for that broken promise.
Okay, next question goes to Janet French.
Hopefully you can hear me. So today, Finance Minister Jason Nixon said that his priority for surplus is going to be on keeping public services at a comparable cost to other provinces, as he'd been talking about for years, saving for the future and reducing debt. What do you think of these priorities for any surplus?
Well, as we've said before, the government doesn't actually keep our public services in line with that of other provinces. They've cherry-picked provinces to compare to, and they ignore that every other of the other 6 provinces actually spend significantly more than Alberta. So if they were to actually do it, that might be an idea, but they haven't been doing it all along. And we've seen the outcome of that today. We've seen these folks here talking about emergency surgeries being diverted from a major urban hospital in our largest city as a result of the kind of funding cuts that this UCP government has imposed on our healthcare system. So that has to be corrected. As well, I understand that the UCP finance minister talked about spending Alberta's hard-earned tax dollars on a UCP vanity project with respect to the police force. Nobody wants a provincial police force. Families who can't who can't put groceries on the table, who are worried about whether their kids are good education in a classroom that has 40 kids in it, who are unable to get an ambulance to come if their child has an accident while playing on a playground, those families don't care one bit about a provincial police force, and it's time the UCP start listening to the Alberta who are very concerned about the direction this government is taking this province in.
Did you have a follow-up?
I do. So, presuming that the way you're speaking today, more generously fund a provincial health system or education, other public services, where would you find the ongoing revenues to support higher cost public services beyond this current oil boom?
Well, as you know, this government, the first thing they took money away from disabled children in our families that this government have been attacking since pretty much the day they got elected would probably disagree. And I would say that there are reports out that argue that those folks are able to use the money most effectively and in a way that would be least impactful on inflation at the same time that they need it the most. This is a government that has made value-based choices all along the way. They don't seem to be worried about inflation when they give billions and billions and billions of dollars to profitable corporations, but at the same time suddenly they're worried about inflation if they give enough for a family to be able to feed all of their children vegetables every week. So the fact of the matter is that we've got an inflationary challenge that impacts low and middle income families far more than it impacts higher income families. And it is time for this government to step up and have the backs of the vast majority of Albertans who need someone in their corner.
Did you have a follow-up, Catherine?
Yeah, a follow-up along the lines of Janet's question on reining in spending and how the finance minister says we shouldn't be outspending other provinces. For healthcare, would you want to see just hold the line or increase by inflation by population, or do you think we need to increase spending beyond that to fix the current problems? How should that spending go for the healthcare system?
Well, let me say at the beginning that, I mean, I'm a kind of evidence-based person, so I would always want to get generally briefed. But what we know is that frontline healthcare professionals have not had their wages increase in line with inflation, not by any means, nor have the folks who have to supply services and materials had their budgets increased by inflation. At the same time, we know that the pressure on our healthcare system has gone up exponentially during COVID. So to use the spending patterns of 3 randomly chosen other provinces, each of which are significantly larger than Alberta and therefore have the benefit of volume when it comes to the per capita spending levels that they have, is an incredibly arbitrary and damaging measure. And as a result, what this government is actually doing is trying to create the runway to privatize more and more healthcare services. So what we need to do is focus on where the cost pressures are are, and also focus on collaborative means to improve the crisis areas that have developed as a result of UCP funding cuts, UCP mismanagement, and yes, also COVID.
Okay, one more pass for questions in person or on the line. And seeing none, that's all for today.
Thank you very much for watching, and to learn more, check out albertasfuture.ca.